folks. We're going to start blocking those last rows. Where's Julie? Julie, get the crime tape out.
That's all
We're
right.
going to block the last rows so nobody can sit back there. So anyway, this is our second iteration of Public Health Grand Rounds, and we're happy to see you here. With this, we are learning as we go how to make this interesting and useful for all of us. So what we're going to do this time is a little bit different than what we did last time. And we really do want you to fill out those forms and let us know what you think about how we're doing this and how we're changing it. The goal is for those of us in public health practice and those of you in public health academia to collaborate and learn from each other what works, what doesn't work, problem solve, get ideas from your research. So the idea is an exchange of information, exchange of ideas between the two disciplines, so that here in Knox County, we who are practicing public health can really take advantage of the folks who are spending time doing research and cutting edge, gaining information for public health. And so we want to put those things in practice. And it's been a challenge to make the two meet, because so much of what we do in public health every day as practitioners is very broad and general, and some of what you do in research is much more narrowly focused, because it's really hard to do broad general research. But we're working on this. So today you're going to hear from three folks, and Dr. Irwin will introduce the speakers for today. And again, please fill those forms out, and this is open to anybody who has an interest in public health. We do not limit it to our staff or to forum members. The region is certainly welcome, and I think we've sent invitations out to them. And so we do want anybody and everybody who's interested to be here and participate. So without further ado, Dr. Irwin.
Thanks, Dr. Buchanan, and thanks again very much for hosting the Public Health Grand Rounds. It's my privilege to introduce the speakers for this morning, or this afternoon, sorry. First is Dr. Chen, who is with the Department of Public Health, University of Tennessee, where he joined us in 2010, having received his PhD in comparative pathology from the University of California, Davis in 2003. Before coming to UTK, he was a senior project scientist at the Center for Health and Environment at UC Davis. He graduated with a Bachelor of Medicine, majoring in preventive medicine in 1993, and a Master's of Medicine majoring in epidemiology in 1996, both from the School of Public Health, Beijing Medical University. Dr. Chen's main research focus is on environmental impacts on reproduction and physiological development. Specifically, his group has been working on the potential adverse effects of xenobiotic exposure on hormone-regulated endocrine systems. And I think one of the things that I would point out here is that for the first time, really in the history of the public health programs at the University of Tennessee, Dr. Chen provides us with bench science expertise. So he maintains a lab in a separate facility on the UTK campus. Our Knox County Health Department speakers this morning include Iannacone. Mr. Iannacone is the environmental epidemiologist at the Knox County Health Department, where he monitors environmental factors affecting public health and makes recommendations on the same. He has an MS in chemistry from the University of North Carolina, go Tar Heels, in 1983, and a BA in chemistry from LaSalle University, Philadelphia, Pennsylvania, in 1981. He began his career at the Kansas City Water and Pollution Control Department. Among other things here at the Knox County Health Department, he provides emergency response support for environmental incidents and expertise to Knox County for incidents such as chemical leaks or spills, investigates cancer clusters or other environmentally related cases of illness, and also educates the public on environmental topics and their effects on health via reports, media appearances, and occasional talks. Our second Knox County Health Department speaker is John Duncan. Dr. Duncan is the current Director of Pharmacy for the Knox County Health Department and has been employed at the Health Department since July 2001. In addition to his duties at the Knox County Health Department, Dr. Duncan is an assistant professor for the University of Tennessee College of Pharmacy. Prior to his employment with the Health Department, he practiced in the areas of retail, hospital, and home health pharmacy. He received his Doctor of Pharmacy degree from the University of Tennessee Center for Health Sciences in Memphis. Additionally, he holds the degree of Bachelor of Science in Biology and a BA in Psychology from the University of Tennessee here in Knoxville. A native of Memphis, he is the proud father of 2 daughters, and his wife Lynette is also a pharmacist in the Knoxville area. So please join me in welcoming our speakers, starting with Dr. J. Chen. Take it away, Jay.
Thank you so much for having me over here, and I think this is a great opportunity for me to learn from my colleagues who's working as a practitioner and to deal with the community health. And I'm mainly focused on the bench work, so very often we only focus on what the money coming from, who can sponsor me and who will be interested to sponsor my work. But very often I really don't know what the community setting, what they really need. So this is a good opportunity for me to come over here to share information with all you guys.
Let's go.
So let me quickly go over, what the fresh water we're talking about. Fresh water is only 3%, on the earth, and the majority of them actually is that's called glacier or ice cap water, which is our biggest reserve water we couldn't use at this moment. And only 1% actually does belong to the groundwater, or that's 1/3 of 3%. And the other 0.9, that's water vapor, we couldn't use it at all. And for the 0.3%, out of that 3% that's belong to the surface water. So again, this is how we use our water, and the majority of them go through the agriculture activity to support the human being needs. And only 8%, that's what we use as local people. And when we talk about the public water system, we, in general, by the definition from the Safe Drinking Water Act, we talk about either public water system or private water system. And for the public water system, it can further be divided into a couple of categories. The first one is community water. That's where majority of us get water from. So it should cover more than 25% or more than 15 service connections. Has to serve the people year-round. And the second category that's called non-community water system, which provide at least 25 people and at least 6 months in the whole year. But that can be further divided into either a non-transient, non-community water system, which means they serve the same person for at least 6 months. And another category will be so-called transient non-community water, which is we talk about a motel or gas station that do serve more than 25%. However, that don't serve the same people for 6 months. They just people come in those. Unfortunately, for the private water supply, it's not protected by the Safe Drinking Water Act. So the Safe Drinking Water Act only provides the criteria what should be measured for the public water system. And this slide just show you where the potential contamination could come from and get into our surface water. And can further divide into 2 different parts. One is called a non-point source, which means the contamination source is very diffuse, like from the rural home, corporate cropland, or animal feedlot. It's hard for us to identify where exactly those contamination coming from. So we call it mainly through the runoffs. The second category we call it a point source. For example, like a wastewater treatment plant, or like from industrial facilities. They do have wastewater treatment capacity. So after the wastewater treatment, and it will be discharged into the surface water. And very often we thought, the water coming from the wastewater treatment plant should be clean. Unfortunately, that's not true because the waste treatment water facility doesn't have 100% efficiency to remove most of compounds. This is a good example of past in the U.S. in the history, which is the Iannacone River, because of discharge of industrial waste directly into the water. So what is often called fire, which you won't see this anymore because of tighter federation regulation. And this is a second category is groundwater. Groundwater, very often we talk about two different types. The first type called unconfined aquifer, which the water be recharged directly from the topsoil on top of the aquifer. The second category is called a confined aquifer, which is separated by impermeable layers. So compared to the unconfined aquifer, in general, to say the confined aquifer is deeper and less contamination in there. And this is a problem often we see in the coastal region area. And they do have a well here, however, because overpumped water, the interface between the aquifer water and the seawater will be pushed inside. So as a consequence, a lot of seawater will be pumped out. So that directly affects the quality of the water. People use it either for agricultural purpose or for residential use purpose. And these slides show you where the potentially contamination from to contaminate our aquifer. You can tell the mainly is from the seepage from the landfill, or from sewer system, or this is on-site septic tank, which about 1/4 of the United States population based on on-site septic tank to treat their wastewater. This is what are present currently in the US system. And the first category is we are familiar with the bacteria, parasite, or virus. And Dr. Irvin last year, he gave a lecture talking about the cholera, which happened in the United Kingdom back to 1850s. And the recent paper also showed by the UT faculty, which they found the virus and bacteria in the karst aquifer, because the karst aquifer is made by carbonate, and our precipitation is a little bit acidic, so that they can, the contaminant can easily go through the sinkholes, get into the aquifer. The second category for what currently in the U.S. system is called organic or oxygen-demanding waste. They may not be toxic. However, those, because organic in nature, once they get into the system, they demand a lot of oxygen for the decay process. They mainly hurt the life species in the aquatic system. However, there's a compound here, which is the nitrate. We all know it's called the blue baby syndrome. That's nitrate is heavily regulated by the EPA. So EPA monitors the level of nitrate in the public water system. The next one is called the inorganic chemicals, which I and Chen will talk about. And mainly we cover the mercury and the lead. Mercury exists in the sediment of the river system. So we talk about the human exposure through the food chain. For the lead, mainly coming from the pipes, which we talk about, we drink the tap water. Potentially they might have a high concentration of lead from the tap water. Others is organic chemicals. This category we talk about toxic chemicals. Mainly cover some plastics or pesticides. Another group of compounds which we call the pharmaceuticals and the personal care products. That's one of the hot topics right now. And the major problem with this category of chemicals is the central nervous system, or sometimes they can occur cause of reproductive disorders. And some chemicals might also interfere with the immune system, so they can suppress the immune system. This is what happened in the Gulf of Mexico. It's notorious for the hypoxic condition because the runoff of those fertilizers from the river of Mississippi, so all the way being discharged into the Gulf of Mexico and cause the dramatic depletion of oxygen in that area. In summarize this chart, what currently in the U.S. system, the first one, the classic one, which includes the mercury, lead, arsenic, or radon, and also including some PCBs or dioxins in the sediment. The second one, which is the hot topic currently, we talk about from the disinfectant like bleach, and also from a lot of personal use of fragrance, insect repellent, and the UV filters like the sunscreens. Once we washed out from body, and it can find its way to get into the water system. And the last one is the flame retardant and bisphenol A, also being found identified from either surface water or from the aquifer. I guess in general, the question people would like to ask is how efficient our on-site treatment could be in terms of population. How much we can stop to get into the aquifer. The second question that often people want to know is whether we can identify the PPCBs from the different of on-site waste tank. And the last question people usually want to ask is how persistent once those PPCBs get into the aquifer, how long they can stay over there before being removed by the microbials or microorganisms. And this is a current one just published, I guess this is a report sent to the Tennessee Department of Environment and Conservation. And Alice Layton, who is a researcher in the UT, and she tested in the untreated water in the Tennessee state. And she found actually 1/3 of our water systems do not contain any chemicals. She tested 15, I don't recall which 15 there. But only one has the EPA's standard limitation. The rest of 14 has no criteria right now. So she found 1/3 of the 350 samples contain no chemical, which is good news. And she further found another 1/3 contain more than one chemicals. The good news is the least frequent detected chemical is the PPCB, which largely is due to John and our drug taking back programs. Thank you very much. Now it's Chen.
Okay, I'm going to take a look at sort of the groundwater aspect of this. Basically, we have some very fundamental questions related to these issues that we don't even know how many wells there are in the county, where they are. And so, before we can start to deal with the questions of protecting the public health, we need to get our hands on some of these more basic issues. And so I'll kind of go into that issue. Sort of building on what Jay said, there's a lot of recognition that groundwater is a threatened resource, a number of sources that he mentioned, bacterias, nitrates, pesticides, herbicides, volatiles. The figure on the lower left there is from the U.S. Geologic Survey, and the sort of central greenish kind of area is the Valley and Ridge province, they call it, which includes Knoxville. And so there's Knoxville, sort of, I guess, up towards Halls. There's one monitoring well. That's all that USGS has for the entire county. And they found 4 to 6 compounds in their monitoring well here. You'll notice in this figure there's sort of like zebra striping. That's indicating the 2 different kinds of rocks that we have predominantly underlaying us. sort of carbonaceous rocks are the light color, the limestone that Jay was talking about, those are an abundant source for groundwater. The other type of rocks would be more silicon-based quartz-type rock, and you wouldn't get very much groundwater from those at all. So again, this is at an even finer scale. You can see the ridges and valleys, and some areas have limestone and some have harder impermeable rocks. Again, the karst that we have here provides abundant groundwater, but at a high risk for contamination. And basically the issue there is, if you look on the, this is a piece of limestone that's typical of what you find in karst terrain. It's basically like a piece of sponge. It's all full of eroded areas, little channels. You could, this is a rock I have. You can pour water through it. I've taken it to grade schools for demonstrations. And then, over time you can easily see how these fissures would continue to erode and, eventually create the many caves and losing streams, features like that we have in the county. So that's sort of the underlying geology. What are the threats that we have here? Well, according to the Department of Agriculture, we've got over 1,200 farms, over 83,000 acres just in Knox County. We tend to think of Knox County as an urban area, but sort of all around the edges of the county, if you get out to those areas, it's decidedly rural, and all of the factors that Jay was mentioning as threats to groundwater are found on farms. You've got bacterial sources from your pastures, any feedlots, from the septic system if there's a problem. Obviously on farms you have fertilizers, pesticides, and herbicides, which the fertilizer would include the nitrate. Vehicles, heavy equipment, tractors, that kind of thing, could be sources of fuel leading to hydrocarbon contamination. While it's not legal anymore in Knox County, there's certainly a long tradition and probably continued practice to a degree of burning trash or other rubbish. That can be a source of polynuclear aromatic hydrocarbons and dioxins. And finally, the home septic system also would be a source for pharmaceuticals and personal care products. So the whole spectrum of threats can exist in a rural environment. And so, farm families, since they're not covered by the Safe Drinking Water Act, are at decided risk for groundwater contamination. At the health department, several years ago, we went back and out of 115 samples that were submitted to us for bacteriological testing, 50 of them came up positive for bacteria. So obviously those are self-selected people that are concerned that they might have a problem, but even given that, it isn't an indication that there's a potential issue there. In addition to the farms, we have specific incidents that have cropped up over the years that were direct threats to groundwater. Some of them you probably recognize from being in the news over the years. Burnett Creek was a brownfield site. Well, there was soil taken from a brownfield site just north of here, the Coster Shop train yard, and all that contaminated soil was taken south of the river and used to fill a sinkhole. Well, all the folks in the neighborhood ended up with groundwater contamination, and there had to be emergency testing of the water and water lines brought in on an emergency basis to provide them with drinking water. The Tedford Road site is out basically just on the north side of the river where Pellissippi Parkway would cross that area. Someone had an illegal dump. It caught fire. Unfortunately, they were using their dump to fill an area where there was a sinkhole. And again, the residents were concerned that their groundwater was contaminated. So fortunately, in that case, it wasn't. But again, the problem that we've had over and over again is that we're in a reactive mode. There's an emergency, we have to go out, find the wells, do any testing, and there's got to be a better way to do business. So here's another look at Tedford Road to give you an idea of the scale of it. That's two people there sort of looking down into the pit. There's various logs. A lot of this was sort of kind of like tree trimming waste, that kind of debris. It wasn't really trash. You can see here, here's as it was burning, they're having to dig out the underground portion of it and spray fire hoses down into there to try to put it out. This fire started underground several years ago. We had a drought, and basically all this soil was baking as the material was slowly decomposing. And sort of right before Christmas Eve, it caught fire, and the way it was identified was some of the wealthier houses along the road, their carbon monoxide alarms kept going off. And emergency personnel were called in, folks had to be evacuated. So this is sort of the geology of the area. This is North Shore, Helath Mountain goes down through here. Tedford Road is just sort of in this narrow little ravine here. The bluish dots are springs, and the little triangles are sinkholes, and so this is where things were happening, and there's a sinkhole right there. So not a good situation, kind of a perfect storm of groundwater contamination. This is the area where the sinkhole was. So as I said, there's got to be a better way. This has been a known problem for 20 years. Since 2000, the state has required that newly constructed wells be registered. But before that, their data was very spotty. They tried to get records, but they were on paper. And same thing with the health department here. When people would ask us to test their wells, we would have records, but there was no systemic sort of generalized collection of information, so we decided to take that on. Kind of a fool's rush in, where we should have maybe known better. But we went to KGIS, the city, county, and KUB GIS utility, and asked them to do a comparison between property taxpayers and water utility customers, figuring if someone's paying property tax but not paying a water bill, they must be on a well. Well, in theory, that's a very good idea. Unfortunately, it turned out about 60,000 records. We pared it down to about 15,000 potential addresses by eliminating any places of business and just looking at residences outside the city limits. But still, information we had made it look like that was way too many wells. So we figured we'd have to try another approach. And we used a combination of postcards to residences outside the city limits, asking them if they were on a well or knew of people with wells, and a media campaign promoting a website or a phone number where people could register their well. They could either call the health department and give their information, or go to sort of a SurveyMonkey site and answer a few questions. And part of the reason we thought that 16,000 was way too high was that the state had done an estimate in 2005 of how many wells they thought there was, and they said in the county that there were approximately 3,300. This map shows the different water utilities where their service areas are and how many wells the state anticipated were in those portions of the county. Just because an area is shown as being in the service area of a utility doesn't mean the utility is providing everywhere. That's just the turf they've staked out to avoid having wars with the other companies. They have these agreements that, okay, if you're in Halls, you'll get your water from the Hallsdale Power utility as people are identified or new homes are put in. So we're making progress on this issue. We had a student intern from the vet school who was invaluable in helping us process the data as we were getting responses on the cards and on the website. Fortunately, it didn't cost very much to do this, just the cost on the postcard, because we had no budget. We just had to try to scrape the money together as we went along. The media campaign went very well. Part of the way we were promoting this was in connection with emergency response. My position is funded as part of emergency response, actually, and so, as I said, we've had several incidences over the years where we ran into problems and had to react. And so, hopefully this will enable us to be a little more proactive. If there's an incident, we can say, okay, we know this road, that neighborhood, this subdivision are on wells, and we need to contact those people immediately. That's the goal. Most of the response from the public has been favorable, although there were a few folks that were concerned that we wanted to tax their wells. And we estimate we've got about we've got about 1,200 or 1116 or 1166 rather wells. We estimate that's 20 to 30%. I gave you that figure from TDEC. EPA has their own way of estimating how many wells they think are in an area. That showed a slightly higher number. But, this map here shows where we've identified wells. And as you'd expect, they're in the rural areas like Strawberry Plains, northern border of the county, down as you get towards Seymour, Solway. A lot of these we identified ourselves when there was concern about the spill or a sinkhole that developed at the mulch plant. And then a lot of these little areas, sort of wealthy rural areas that look down on the river bluffs. And I could use another intern. Obviously, there's a lot of wells yet to identify, so if you ever run into a student that's interested in helping with this, there's a lot of other directions we can take this as well, and questions maybe of what's the most effective way of marketing it. Asking people how often they test their wells. There's all those questions since they're responsible for their own well safety. What's the most effective way to present the message to them of, encouraging them to provide for their own safety most effectively. So that's pretty much where it is. It's ongoing, and like I said, we'd be delighted to ever have another intern to help take it to the next level. And John? Little red X will shut it down. Here? No, sorry.
Yeah, fine. Yeah, fine.
A little technology challenge sometimes. Thank you. I'm John Duncan from the Health Department, and really you wouldn't think pharmacy would be involved with this issue, but we've had some discussions with Al had come to me. He would get calls on, well, how do we, from the public, well, how do I dispose of XYZ prescription product? And quite frankly, 10 years ago, what I would have told them, well, just flush it down the toilet. And if you talk to any pharmacist, that's probably what they would have told them. Physicians, I suspect, too. Well, we, through efforts like Dr. Chen's, that's probably not the smartest advice we can give folks these days. And so, and we're just now becoming aware that there's some studies in the Northeast where they looked at water systems, and lo and behold, they tested specifically for pharmaceutical compounds, and they were there, which was a big shock to the public in general. So, as most of the best type of public health projects, it was a collaborative effort. Al had come to me and said, hey, can you help with this issue? The law enforcement has got an interest in this as well. And their tact was mainly from a property crime issue. If you all have watched the news, that you have seen that really the number one cause of death that's most disturbing these days is prescription drug overdose. So they were seeing an increase in property crime from people who were unfortunately addicted to prescription pain medicines going into people's houses to try to find those products. So that's the tact that law enforcement came at it from. So, we quickly realized that we all had a stake in trying to reduce the amount of unused prescriptions that were out there. So it just kind of gelled around this task force that came about. And it was made up of law enforcement, health department, and county and solid waste management professionals that you would imagine. The other group that was involved, which was kind of nice, was the UT College pharmacy students wanted to take an active role, which was, it was very heartening to hear that kind of involvement was happening in the educational process. When I came through school, public health, I had no formal training or classes in public health from a pharmacy standpoint. Fortunately, that's changing, so that's a good thing. So I don't have a lot of, I've got slides mainly just about how we set these things up and kind of the logistics and nuts and bolts of how these things are done. Fortunately, we have on our task force many folks who have a logistical bent. John Holma from the City Solid Waste Department is very good at this. What we realized very quickly, and we were very fortunate to have the law enforcement presence, is although drugs are very regulated when they go to the patient, the regulations are kind of sketchy when they, if you go to try to take them back from patients. But the one area that is very regulated is the controlled substances. The DEA is very interested in how those things get disposed of for very good reasons. So they insisted that we have a law enforcement presence. So if somebody brought controlled substances, they could be surrendered to an officer of the law at that point, and then that goes in along with their evidence destruction. And it actually solved a problem for us too, because as a health professional, I wouldn't want to have a bunch of controlled substances in my possession that they didn't have a record that I obtained. So there's a little bit of selfishness from a professional standpoint as well. We have done we try to do about 4 of these a year. They're a coordinated effort. This was one that we actually did at a local grocery store, Food City, off of, I think this one was off Broadway. There are a variety of settings. The first one we did was in the old Kmart parking lot in West Knoxville, if any of y'all are familiar with that, and Kmart was in the process of closing, and the first day we picked was in a November event, and it was very cold, very rainy. So we took some lessons learned from that. We always try to we like to be under an overhang with a physical barrier behind us, and that was from our law enforcement partners. From a safety perspective, you can't have somebody come up behind you and potentially knock you on the head for your expired products. And believe me, that is a concern. This was an event our most recent event that we did at West Town Mall on the 12th. And this was part of, not Earth Fair, but America's Recycle State. Sorry, my acronyms are not great. So not only were we there was a lot of other partners in the recycling arena who were there as well. But this was a very successful event. lots of media. Channel 8 came by and spent about 45 minutes to an hour with us. So that was good. Just as kind of a summary of kind of where we started. We started kind of what I think is strong, and we have just kind of continued to grow. These events get a little bit more popular every time we hold them. And this graph is nice because it shows when we go to collect these medications, we are not only looking at the medication per se, but also the packaging, because there is an awful lot of packaging that comes with prescriptions. So we separate those out. The medications go into the evidence chain with the law enforcement, and the packaging goes into the recycling stream. So you kind of get two bangs for your buck on that, which is really, really nice. And this is just a jar full of expired samples. And you may want to quick guess of how many pills are in there.
2,453.
Wow, you're good. 2,500. And so that's about 2.5 pounds of actual pills, not counting the glass container. So we actually had a program here at the health department. It's called the Dispensary of Hope. And the idea was we take expired samples and then redistribute it to folks who did not have the financial means to get it, and that's where these samples came from. It was another way to get kind of medications out of the waste stream. But what kind of impact have we had with this program? And we were hoping to break the 4,000 pound mark at this past event, but we got real close. So we've got almost 4,000 pounds of medication on them. Just put that in perspective, each pound can contain, based on the pill size, anywhere from 500 to 1,000 pills. So that means that we have taken about 2 to 4 million pills out of the waste stream. And that is just, I haven't really put that number on paper, but that is a staggering amount of pills. And this is just the tip of the iceberg. We usually will get those folks who are, very, seem to be altruistic in nature and just, they want to do the right thing and they want a safe way to dispose of it. I suspect there's a lot more folks who just, for convenience will just go on and flush it down the toilet or throw it in the garbage. So this is just kind of the tip of the iceberg. So it's kind of nice. There's a lot more work to be done, but this is a good start. What will be helpful to us is, from a public health and to connecting with academia, is Dr. Chen's work with, effects on reproductive systems. Those are pieces of information that we can use to market to the public to help, grow these type of programs with, connecting it to actual effects. You do this, this happens. So it's been just a very, very nice, very nice collaborative effort. And one of my pharmacy students, Morgan, he's in the audience here. He is actually one of the students. I first met him through this through this event, and he has kind of come through. He's in his final year of school, almost there. And he came up with these 3 bullet points where it just kind of captures the whole impact in a nutshell. And why do we do it? Well, it discourages criminal activity and drug diversion. It potentially has a great impact on our environment. And the other benefit that we had from a psychological, aspect is we would have people come to the events and, Grandma just died and I've got all her medications, and they're a constant reminder of all the struggle that we had. And so thank you for providing a way to dispose of it. So it provides closure, and it just, for those people who just want to do the right thing but don't know how to get rid of it, gives them a way to do that too. We have these events about 4 times a year, but the other benefit too is at the safety building, which is behind the convention center, we've established a permanent drop box. So you don't have to wait for one of these events to dispose of your medications. That is, it's basically just a big mailbox. It's in the building, so it's monitored. But the property officer will take those products and package them up with the evidence and really dispose of them, with each evidence run. I believe he is getting about 50 pounds a week just from that drop box. We're hoping that we can put more of these drop boxes in more convenient locations around the county. Of course, the issue is always cost and manpower, because you do have to maintain these type resources. So that's kind of what we're doing based on this information. And I would invite you all for your feedback and questions at this point. That's all I have on my presentation. We also have a website as well, medicationcollection.org. One of our partner organizations has really spearheaded using this one web address as a clearinghouse of information. So that's a good resource as well. All right.
John, I will ask you as Jay and Al and you all joined together there. So what happens to the medications? Where do they get disposed of?
They are incinerated along with the waste stream or the evidence stream that the police department collects. So all the drug seizures and all that kind of good stuff, they kind of throw them in there with the drug seizures and dispose they are.
Yeah, basically they have a incinerator that, I haven't seen it, they're very secretive about where it's located. It's out in a rural part of the state, that's all they'll tell us. But supposedly it's big enough to drive a van in, because you would not believe how many bales of marijuana they have that, they look like bales of hay. And just, once or twice a year, I guess, they go and take this all out and incinerate it.
So we have about 10 minutes for Q&A. Questions?
My question is for you, Dr. Duncan. Thank you for that presentation. Thank you all for that. But I was curious, you talked about the desire to add additional drop boxes for the collection on an ongoing basis. Have you looked at possibilities of linking up with some of the pharmacies, since they kind of know about medicine, and having some of those in like Walmart's or CVS's where they already have manpower and already have facilities as possible drop points?
We have thought about that, but it gets back to the regulatory environment and the need for law enforcement presence. We are licensed to dispense medications, but not really take those things back. You could put a mailbox-like device outside of a Walmart, Walgreens, but somebody as resourceful as criminals are, could hook a chain to it and take it right on off. So I think the DEA is very hesitant to let those kind of devices be put outside of the law enforcement arena. Yeah, it would be great if we could find a way to do that.
Do you have any feeling on whether people are turning in veterinary products?
We have had some veterinary products, which I was a little bit surprised. I am and I'm not. I mean, there are pharmaceutical products like anything else, but yes, we have. It's been kind of good to see. I think sometimes people don't really, consider those type of products, but really they should.
I don't remember any of the publicity on these days, including that. Maybe you have, but
I don't think we marketed specifically for that. Sorry, I didn't mean to interrupt, but that's certainly something we could consider doing.
But the veterinary medicine is what we found in the biosolids. So after the treatment the wastewater, they collect the sludge and convert sludge into the biosolids. Then they tested almost the first couple of the top chemicals or compounds they found are those being used in the veterinary settings.
So to sort of follow on that question, if I could, Jay, so back to the study that you quoted, someone at the University of Tennessee who had tested for 15 different chemicals. Are some of those chemicals that you would find in pharmaceuticals?
I believe yes. Yes, for the personal care and product, and as well as for the pharmaceutical, yes, you can find it, yes.
So
Mainly like anti-depression drugs.
So it, not to, to get around the issue, but what John has described here isn't being done just because it seems like the right thing to do. There are actually measurable, there's measurable evidence from pharmaceuticals being put into the water system.
Exactly. However, the thing I have for John is, how to advertising, his program, so more people will know there's kind of activity going on. Because before, the first couple of months when I came to UT, I don't even know until I had Ian talk in my class, and he introduced the effort between John and himself to set up this drug taking back program. That's how I know that. But the majority of my students, they don't know that either at that point.
We have another question up here.
Can you talk
Margaret?
about putting the drop boxes for the medications and police stations and other places where it could be considered to be monitored? I just think, I'm just thinking about, well, for example, my dog is on phenobarbital. I have more controlled substances in my kitchen than I care to think about at this point. I mean, I've never really thought about it. She's the second dog I've had on phenobarbital, but it really makes a lot of sense. If something were to happen, I would really have a lot to get rid of. And I think waiting until, the quarterly events, it would be better to get rid of it.
Yeah, we've, like John said, we have the one box at the police station near the Coliseum. And I think the fact that it's been so successful, we're hoping to maybe get the sheriff's office. They have out in far west Knox, they have a location that would be appropriate. Also, the state police have their building right across from West Town Hall, would be another location. Problem is that, it's an unfunded thing that we're asking them to do. 50 pounds a week coming in, it takes a significant amount of time to manage all of that, and just we haven't convinced them yet, but we keep working at it.
I promise not to flush it down the toilet.
Thank you. We appreciate it.
Charles, I think you had
That was really my question. If law enforcement entered into this area enthusiastically, I know that, they have helicopters and they fly over looking for marijuana, and this would grow a lot of marijuana around here. The farm parties, where particularly youngsters are going in and taking unknown pills out of bowls and so forth, has been discussed by the national media. I would think law enforcement would be really interested in this.
Yeah, and the Knoxville police were immediately right on board with this when we approached them for exactly those reasons. Just in terms of others, we're hoping to persuade them.
It really becomes a question of resources, I think, unless they see just if I do this, then this happens. It's very hard to convince somebody with limited resources to put the resources in this area, although they're trying.
I'm really pleased, John, that you mentioned the resources, because I know Dr. Chen is working with the recycling on our campus, and that was a big issue. In the Beacon yesterday, we're trying to do a recycling program with 2 people. They're looking at electronic waste, and there's no money behind this. My question to the 3 of you, have we ever had a summit or a forum in this county that brings all these individuals together to discuss a plan by which we could all cooperate, from the legislators, the pharmacists, the academicians, the recycling, the people, because I was part of that Witherspoon business at one time as well. Has there ever been mention of this? To set forth a plan and an action to protect our water system?
I don't think we're, go ahead.
I think that's a great idea. You know,
We've not really had a formal summit, although that, like Al said and Dr. Chen, that is a great idea. We're kind of really in the infancy of this. We're just now kind of gelling around the idea that, hey, we might have a problem. But in order to get people to come to the table, sometimes you really need strong, compelling, written evidence. And I don't think we've got a lot of anecdotal evidence, but I don't think we have strong written evidence yet. So
Yeah, and I think a lot of networking to run these events has been happening, but I don't think a formal summit type event that you've described has happened yet.
I think it's a great idea. I really do.
One more thing I would like to add, I'm sorry about and those pharmaceutical and personal care products, once being treated and they end up in the solid, as I said, and those biosolids being used in the agriculture setting. So there's solid evidence to show those chemicals actually get into the plant. And some of those chemicals are bioaccumulated in this plant. So human beings, under the threat, we take the vegetables, we take some food, and we also take those persistent chemicals into our bodies.
Al, if I could ask a question back to the wells. It's really a two-part question. So what are your plans for going from roughly 1,200 wells to getting to the number you think that are existing here in Knox County? And then what? Once you identify all the wells, what next?
To get there, we still have the website. It's a matter of periodically just re-promoting the website, doing another media push. There are certain sort of national days like Protect Your Well Week or something that we can use as a way to try to get that message back out again. Asking folks here to work in supporting that around all their other existing duties. What do we do with it once we have it? Well, emergency response is part of it, but we also get phone calls, especially now that there's more knowledge that we actually have some information on this from people that are, say, interested in buying a property and want to see, does it have a well or is it on utility? They can also get that information from the utility, but we're another source that they might think of to ask that question.
One last question. Go ahead. Yeah.
You cited one well in the county that was being monitored?
That was by the U.S. Geologic Survey, and they have a national network of 20,000 wells, but it's a big country, and when you spread 20,000 over the whole country, you get one.
Oh, so they're not interested in monitoring anymore in this area?
No, they monitor more heavily in areas where